So for tonight, we're going to talk a little bit about the US Transgender Survey, particularly how some of those findings can be used in advocacy and for sharing our stories. I am Rebecca Kling. I'm NCTE's Community Storytelling Advocate, and I work with trans folks and allies to help get out stories that support trans rights. And tonight, we are hoping to think about how we can use some of the data from the US Transgender Survey to fit within our stories. We're going to talk a little bit about the background for the survey and some of the key themes that we saw throughout the survey, and then dive into some of the specific topic areas, as well as how to connect that to your story, and then thinking about what comes next. Disclaimer, and this should look familiar to others, to folks who have participated in other NCTE webinars, we're encouraging you to speak on behalf of yourself, so we're not asking you to be a representative of NCTE. Likewise, you absolutely do not need to be an expert on the US Trans Survey data to use it effectively. We aren't encouraging you to memorize it. You don't need to have all of the stats at your fingertips. You can really use it effectively even with just a couple of key numbers. And because I'm a dork, there are some fine print jokes as well. So, a little background about the USTS. In 2008 and 2009, NCTE worked with the National LGBTQ Task Force on the National Transgender Discrimination Survey, or NTDS. And this got about 6,400 respondents. This was an incredible success. It was cited by news, by businesses, by government agencies all around the country, and it really gave a voice to trans folks to be able to say, this is not just an individual problem, this is a systemic problem. At the same time, it had room for improvement. And so when folks at NCTE were designing the USTS, we had a couple of additional goals in mind. First, we want to just make sure that the data is updated. So the NTDS was in 2008 and 2009. The USTS was conducted in 2015. It was also a much longer survey, and as someone who took both, I can tell you it was a much longer survey. So it had a wider range of topics and went deeper into some of those topics. We also tried to address gaps in our collection. So where are places that people weren't able to get surveys the last time, or where are parts of our identity or parts of our experience that we weren't able to address in the National Trans Discrimination Survey. Similarly, we worked to make sure that the way questions are phrased in the USTS is more comparable to other surveys that are out there. Because the way that the National Trans Discrimination Survey was set up, as much as it was absolutely a success, the questions were sometimes phrased in a way that made it tough to compare it to other surveys like done by the census or other pollsters. Similarly, we want to be able to make it easy for NCTE to repeat this survey in the future, and that was something that was a little trickier with the NTDS. And finally, we just wanted more people. We wanted more people to be able to take it and to have their voices heard. So when we think about the overview of what the USTS showed us, we had almost 28,000 respondents, 27,715, and about a third of them identified as non-binary. Now, one of the things that's frustrating is we cannot say that that means a third of trans people are non-binary, because this is not what's called a representative sample, meaning it wasn't a random selection of trans people across the country. So unfortunately, we're not able to say anything about how much or what percentage of trans people are non-binary. We can say that non-binary people represented a big chunk of our survey respondents and that their voices are just as important as anyone else's. We got respondents from all 50 states, the District of Columbia, American Samoa, Guam, Puerto Rico, and U.S. military bases overseas. This survey was specifically about people who are 18 and older, and I'm going to talk about some other surveys, and I'll send in the follow-up to this some info from other surveys, USTS specifically 18 and over. Similarly, it was only done online, and it was only done in English and Spanish. And we tried to make it as accessible as possible to as many people as possible, but we realized there are people who might not have been able to respond to an online survey or who might not have been able to take a survey in English or Spanish. And the last sort of overview thing I want to do is to show these two maps. And the one on the left is where people took the survey. And the one on the right is where people in the United States live. They look really, really similar. And what's cool about that is it lets us say that transgender people are everywhere, and that anywhere there are Americans, there are transgender Americans. Whether it's in Puerto Rico or Alaska or Wyoming or Colorado or New York City or Washington, D.C., if there are Americans there, if there are people there, there are transgender people there. And that's a really cool thing to see. I want to give a moment for any questions about sort of the survey overview, either in the chat box or with voice, and then we'll move on into some of the key themes that we saw in the USTS. All right. So the survey itself, the full survey report is 300 pages. The executive summary is about 15 or 16 pages, but we can boil down a lot of it into a couple of key themes. First, we saw across the board transgender people are at risk for mistreatment and violence. Similarly, we saw across the board that transgender people are at risk for difficulties with financial stability and employment. We also saw that these take a toll on trans people's physical and mental health, and that they are added and compounded by other forms of discrimination. And what I mean by that last one is, if a transgender person experiences discrimination, that discrimination is made worse if they are also a person of color or a person with disabilities or an immigrant or someone who's undocumented or who already experiences other discrimination. And that's something that makes a lot of sense, unfortunately, but it's really helpful to have data to talk about it. And we're going to go through those different categories point by point. So when we think about mistreatment and violence, because they were transgender, almost half of the respondents said they were verbally harassed in the year leading up to taking the survey, and almost 1 in 10 say they'd been physically attacked in the previous year. Similarly, we saw that almost half, and I'm in a room with automatic lights, so I'm going to wave occasionally to get the lights back on. Almost half of the survey respondents said they'd been sexually assaulted at some point in their life, and 1 in 10 said they'd been sexually assaulted in the last year. So again, this shows that transgender people are at increased risk for mistreatment and violence. When we look at economic hardship and instability, we saw that trans people are 3 times more likely to be unemployed and twice as likely to be living in poverty than the general U.S. population. Similarly, we saw that trans people reported a 30% likelihood over their lifetime of being homeless, and 12% of our respondents said they'd been homeless in the past year. Now, this does not mean that trans people have a 1 in 3 chance of being homeless, because again, it wasn't what's called a representative sample. We weren't able to ask a random selection of trans people their experiences, so we can only say that 30% of our survey said that they'd experienced homelessness at some point in their lifetime. And because this data is kind of difficult to hear, I also have some cute animal pictures throughout, so this is Dr. McSnuggles. When we look at physical and mental health, we saw that trans people were 8 times more likely. Again, I apologize, I shouldn't be saying 8 times more likely. We saw that our respondents, so the people who took the survey, were 8 times as likely to have serious psychological distress than the U.S. population, and 9 times more likely to have attempted suicide in their lifetime. Now, I want to say a couple things about this slide. First, when we say serious psychological distress, we didn't just ask people, are you experiencing serious psychological distress, yes or no? This is part of the reason that this survey is easier to compare to other surveys, because we used sort of best practices in polling to gauge across a bunch of different questions whether someone had been experiencing psychological distress. Similarly, in the National Trans Discrimination Survey, there was a 41 or 42% response of people who had attempted suicide in their lifetime, and this time it was 40%. There have been people who say, oh, that means that suicide risk is going down. Unfortunately, we're not able to use the data that way because they were framed differently, the questions were written differently, and the surveys were conducted differently. So one of the reasons we wanted to redesign the survey for the USTS and to be able to continue doing the USTS again in the future is so we can start comparing things over time. And I'm happy to talk a little bit more or to follow up with our survey research director, Sandy James, if people have more specific questions. When we talk about physical and mental health, in the past year, of those who saw a healthcare provider, 33% were harassed, turned away, or had other negative experiences. 1 in 5, about 23%, didn't seek healthcare because they were worried about being mistreated. And a third, 1 in 3, didn't seek healthcare because they couldn't afford it. And again, this makes everything else more difficult if you can't access healthcare. When we look at specific categories within the USTS, we saw that people of color had an even more difficult time, and that their likelihood of being in poverty was 3 times higher than the U.S. Population. Again, this does not mean that trans people of color in general are 3 times as likely to be in poverty. This means that of our survey, people of color were 3 times higher than the U.S. population. Similarly, 1.4% of all of our respondents were living with HIV, and that's 5 times higher than the U.S. population. Among Black trans women in particular, that rate was a whopping 19%, which means of our survey sample, Black trans women were 60 times more likely than the general population to be living with HIV/AIDS. 60 times. So this is showing that not only does being trans make someone more likely to have more difficulty and have issues of discrimination, that coupling that with other issues of discrimination like racism or like sexism or like ageism or like anti-immigrant rhetoric makes things even more difficult. When we looked at people with disabilities, we saw again that a lot of those numbers were higher. Of our respondents, people with disabilities, 24% said they were unemployed and 45% said they were living with poverty. And undocumented respondents, 50% had experienced homelessness at some point in their lifetime, and 24% had been physically attacked in the past year alone. So again, going over those key themes, we saw overwhelming mistreatment and violence, that trans people are more likely to have economic hardship and instability, that the physical and mental health risks take a toll, and that trans people experience discrimination that is added to, compounded by other forms of discrimination. Any questions on any of that before we move into some of the specific topic areas? All right. When we look at those specific topic areas, there's a ton, and if you have spoken with me before about your stories, these are going to be some similar topic areas to the stuff I asked you about, and part of the reason is so that we can help connect people's stories with areas of the US Trans Survey. For today, we're going to be specifically focusing on experiences in school, in the workplace, around housing, including homelessness and shelter access, in public spaces, and that's sometimes called public accommodations, in restrooms, and around family life and support. There are a bunch more categories in the full survey report, including experiences around military service, including experiences with the criminal justice system, including things about sex work and legal name changes and IDs. So if you're interested in any of those, I do encourage you to check out either the executive summary or the full report. So when we talk about school, it's a little tricky because remember, we were only asking for survey responses from people who are 18 or older. So we weren't talking to a lot of people who were still in school when they took the survey. But of people who did respond, 77%, so 3/4 of those who were out or perceived as trans, had experienced some form of mistreatment in K through 12 because they were trans. 54% were verbally harassed, 24% were physically attacked, a little more than 1 in 10 were sexually assaulted, and almost 20% left school because the treatment was so bad. Now that left school part, I want to be clear, doesn't necessarily mean they dropped out. It might have meant that they decided to start homeschooling or that they went to a different school or that they dropped out. So dropped out is included in that, but it doesn't mean that 17% of our respondents who were out or perceived as trans dropped out. When we looked at numbers for college and vocational schools, it was a little better. So only 24% had experienced some sort of verbal, physical, or sexual harassment of those who were out or perceived as trans. But again, that number is very problematic and very scary. And again, here's a cute animal picture. There's a baby elephant. Baby elephants are the best. When we look at employment of the workplace, because they were trans, of those who had been employed, because not everyone who took the survey had employment, but of those who had been employed, 16% had lost a job at some point in their life. 30% of those who'd had a job in the last year had been fired, denied a promotion, or faced some other form of mistreatment, and 15% had been verbally harassed, physically attacked, or sexually assaulted. So that again shows that being trans in the workplace, being out as trans in the workplace, or even being thought to be trans in the workplace really does make life harder for trans people. When we look at housing and homelessness and shelter access, we saw that in the past year leading up to the survey, almost 1 in 4 had had some sort of housing discrimination or instability, and a quarter of those who had experienced homelessness had avoided shelters because they worried about being mistreated. And that makes sense. Almost 3/4, or over 70% of those who had been to shelters reported that they had had some sort of mistreatment because they were trans. Now that 70% includes any form of mistreatment. So it includes people who had been kicked out of shelters, people who had some sort of sexual or physical assault, harassment, and we didn't clarify, and this might be something we're able to do in future surveys, we didn't clarify if that mistreatment was from staff at the shelter or from other people staying at the shelter. When we look at public spaces, this is also called public accommodations. Of those who visited a place where they thought the staff knew they were trans, almost a third, 31%, had been denied some sort of treatment, had been verbally harassed, or had been physically attacked. Some of this was in transportation, some of this was in domestic violence shelters, some of this was in substance abuse programs, and we saw over and over that trans people have more difficulty accessing care that they need and simply accessing services, going to a restaurant or going to a gym or staying at a hotel or going to a library. When we look at restrooms specifically, it's a little tough because we were asking all of these questions before HB2 in North Carolina. So the survey was conducted in 2015, and we were asking about people's experiences in the year leading up to that, so like middle of 2014 to the middle of 2015. These numbers have probably changed since then because of things like HB2 or because of the bills that are being worked on in Texas or because of what they've talked about in Mississippi and elsewhere. In that data, though, we saw that almost 1 in 10, 9%, were denied access to a restroom in the past year, and that almost 2/3, 59%, had avoided using a public restroom for fear of confrontation. Similarly, we saw that little less than 1/3, 32%, limited the amount they ate or drank to avoid using a restroom. And this is something I've definitely encountered in the folks that I've talked to, where they say they don't eat as much as they actually need, or they don't drink when they're thirsty because they are scared of going to the bathroom. And that can lead to UTIs, that can lead to kidney or bladder infections. And this is an example of why bathrooms are actually important, because sometimes people will say, oh, it's just the bathroom, it's not a big deal. If you can't go to the bathroom, you can't participate in work, you can't go to school, you can't live a public life. And this data shows that. When we look at family life, there's some data that's more negative and some that gives us a little room for hope. So out of those who were out to their immediate family, 1 in 10 said a family member was violent. Almost 1 in 10, 8%, said they had been kicked out because they were trans. And 1 in 10 said they had run away because they were trans. This is of those who are out to their immediate family. On the other hand, we have this graph. And what this graph is it compares what people said when they had families who were supportive versus what they said when they had families that were unsupportive. And what we saw was that people with supportive families were less likely to experience homelessness, were less likely to have attempted suicide, and were less likely to be experiencing psychological distress. And those numbers make sense. If I am supported by my family, it probably means that I'm going to be doing better in other ways. This doesn't mean that the world is perfect. People whose families were supportive still experienced homelessness, suicidal ideation, and psychological distress at much higher rates than the general population. But it does show that there is very, very real and concrete differences of family support. And so that's something that we can draw from this survey as a real positive. And there's a polar bear in the snow, because baby animals are amazing. Any questions about those topic areas before I talk a little bit about how you can use this data in your own stories? All right, so as a reminder, or for folks who haven't taken our story workshops, the basic way that I like to think about story sharing for this is you're first going to introduce yourself, and that might include a definition of transgender. I'm Rebecca Kling and I'm a trans woman. Here's what that means. It might include a connection to your audience. So if you're talking to a legislator, you might say, I'm a lifelong resident of this town, or I know we both really love this baseball team. You're then going to share your story. And when you're thinking about that, you want to share it in a way that is concise, and it's going to make, so concise meaning it's like kept together, and is going to make sense to the audience. So you might share the same story differently at a legislative meeting, than at a city council meeting, than at a rally for trans equality. You can then use that to make the case for trans rights. This story shows that it's so important that we vote, or that we change our policy at school, or that at work we change how we talk about identity. And then you can link back to the why you're the one to tell that story. I need you to vote to help protect people like me. I need you to change this policy to help our trans students, whatever it is. This is certainly not the only way to tell a story, and I don't even want to say that it's the best way. It's a way that we've found pretty effective, specifically when trying to advocate in these places, like legislative meetings or interviews or city council meetings or that sort of thing. So when you're thinking about connecting the US Trans Survey data to your story, you do not need to be an expert on this data. Again, you can absolutely pick just a little bit to help spice up your story. You can use it to give some context. So to say, this isn't just about me, this is about all trans people. And what I'm going to encourage you to do is just one or two facts or statistics. You don't need to try to remember everything. You can just pick one or two to really figure out how to hit home what you're trying to talk about. There's also some state breakout reports, and I'm going to talk more about that at the end. So there's specific state data from a couple of places, from Texas, from Maine, from Pennsylvania. And so if you are in one of the states where there's a state breakout report, you might even be able to say, if you're talking, say, to a state politician, you might even be able to say, so nationally, here's the data, and here's how it affects other people in my state. I'm going to give a couple of examples of how this might work, and these are all fictional examples, but they're drawn from real people's experiences. So they're fictional examples, but they're definitely things that happen to people. So the first one is about someone having a positive experience transitioning at work. They have a boss who's supportive, they have an HR that's really great, and they're better and happier at work now that they are able to be their true selves. So what we can say is this is a really amazing positive experience. Let's look at some of that employment data. So remember, 16% of those who've had a job have lost it because they were trans. 30% have been fired or mistreated in the last year, and 15% had some sort of harassment or assault. So what we can do is we can take some of that data and say, even though my experience was positive, the 2015 US Transgender Survey showed that 16% of trans people who've been employed have lost a job because they're trans. I'm lucky that didn't happen to me, but I still worry a future boss or employer might not be so supportive. So even though this person has a positive story, they're still able to help link it with some of that context and some of that data. We're going to look at another example of a mom with a trans daughter. Actually a parent. The story doesn't say whether the parent is a mom or a dad or something else. So this parent has a trans daughter who's being teased and bullied in school. the teachers are being difficult, and this daughter is unable to succeed in school because of all this teasing. So we can look at some of that K through 12 data. We can look at tons of trans people who experience some sort of mistreatment and different ways that some of that happens specifically. Now again, left school doesn't necessarily mean they dropped out, but that's not something that we can actually say. So this mom can talk about Jenny's experience, this is the fictional child, and then could say, according to the 2015 US Transgender Survey, 17% of out transgender students leave their school because of anti-trans bullying and harassment. I want my daughter to be supported, not to dread school because it's a hostile and anti-trans place for her to be. So again, this speaker is using the USTS data to connect their story to something larger. The last example I want to give is about a non-binary person who has difficulty going to the bathroom in public. And this example talks about being yelled at and screamed at both in the men's and the women's room, and the difficulty of accessing a single occupancy bathroom. So this person gives the example, I have to go outside to an entirely different building at work for a single occupancy bathroom, even if it's raining. So we can look at restroom data, and again, this was before HB2, and this person could say, I'm not alone in those experiences. In the year leading up to this survey, almost 60% of trans people have avoided using restrooms because they worried about being confronted, and almost 10% of trans people were denied access to a restroom. So again, this is taking that data and connecting it to that larger experience. Now we absolutely have time if anyone is interested in thinking about a part of their story and brainstorming how we might be able to connect that to USTS data. So does anyone have a part of their story or something they're curious about that they want to think about how they can connect to some of this data? And I'm hoping this is pretty straightforward, so no worries if not. All right, and there are some adorable otters. So looking forward, there's a couple of things that I want to talk about, and I'm going to follow up with an email, probably not tomorrow, but definitely by the end of the week. I don't want to say definitely. Probably not tomorrow, hopefully by the end of the week, definitely soon. And in that email, I'm going to include some links. I'm going to include a PDF of this slide deck, and I'm also going to include some other resources. There was a really great survey that GLSEN did. GLSEN is a organization that specifically focuses on education around LGBT issues. And they did a great survey of students, so people who are currently in school, that includes data on K through 12 individuals and on trans folks. So that's something I'll also include, and I'll include some other resources as well. And you can find both the full report, so that's the 300-page one, and the executive summary, which is 16 pages, at USTranssurvey.org. That's also where you can find the breakout reports. So far, we've done about a dozen states from Arizona to Virginia. We're working on more every day, and our goal is to get as many breakout reports from individual states as we can. We're also looking at identity-focused breakouts. So in the USTS, every chapter, for example, already has information on how that data might affect people of color. So it has the general employment data and specifically about trans people of color. It has the general public space data and specific data about people of color. We're also looking at partnering with some trans POC organizations to do a specific report that's just about people of color. And we're always open to working with organizations to try and do other breakout reports as well. We've heard interest from veterans groups to talk specifically about trans veterans. We've heard interest from disability advocacy groups to talk about trans people with disabilities. And if that's something you're interested in, the US Trans Survey org website has a way to get in touch with Sandy, the research director, to talk about your organization and what you might want to partner with. So again, some of that disclaimer and fine print, we're hoping that you'll use this to speak in your own voice for yourself. You're not an NCTE representative, and you don't need to be an expert on the US Trans Survey data. And I will now open it up, because this is sort of a quick and dirty overview. I will open it up if anyone has any questions or if there's any additional resources that I can provide either right now or that I can look for that follow-up email. All right. And if there are no questions, then I want to thank everyone for taking the time. And again, I will send that follow-up. If you do have any either feedback, positive, negative, data you were hoping I'd talk about that I didn't, or specific data or resources that you're looking for, please do let me know. I want to thank everyone, and I will hopefully talk to you all soon.